The loss of pregnancy can be a devastating experience for expecting parents because at this point, your expectation and the joy of you having to meet your mini-me is cut short. And if you're not strong-minded, it may leave you traumatized for long. In today's video, we are going to take a quick look at some factors that may put you at high risk of miscarriage and what you can do as a woman to help you lower your chances of having one. Some of these factors are determined, some are not. So without wasting much time, let's just take a look at such factors. Number one, hormonal imbalances. When there is too much or too little of one or more of the hormones in your body, it can affect pregnancy, leading to miscarriage. Most especially, inadequate level of progesterone. Progesterone plays a vital role in supporting the uterus lining as well as maintaining pregnancy. So insufficient level of progesterone can lead to the shedding of the uterine lining, thereby resulting in miscarriage. So, what are some of the things that you can do as a woman to maintain or to improve hormonal balance? Number one, if you're trying to conceive, avoid strenuous exercises for too long. Number two, avoid or reduce your stress level. Number three, ensure that you eat healthy food. Yes, food rich in balanced diet and food rich in vitamins such as vitamins B6, vitamin C, vitamin E, and also eat fiber-rich food as well as food which are rich in zinc. And also ensure that you maintain a healthy body weight. Don't be too overweight, don't be too underweight. Number two, factors that put you at high risk of miscarriage. Yes, that's what we are talking about. Number two, chromosomal abnormalities. This happens when there are errors in the genetic material of the embryo, and this usually happens during fertilization or during early cell division. This factor is unpredictable. It cannot be determined, so it cannot be prevented. There's no way it can be averted because you don't know when it's going to happen. So it cannot be averted. But there are certain things you can do that will lower your chances of having chromosomal abnormalities. Number one, if you're planning to conceive, ensure that you visit your doctor at least, yes, consult with your doctor at least 3 months before you even start trying to conceive. Number two, ensure that you start taking prenatal vitamins 3 months before you even start trying to conceive. Number three, avoid excessive intake of alcohol, avoid smoking, and if you're the type that take drugs, avoid taking drugs. And number four, ensure that you eat healthy food. Number three, uterus abnormalities. Yes, the shape of the woman's uterus can put her at a high risk of miscarriage and also preterm birth. So this factor, remember I said some factors are determined, some are not determined. This factor, please, is not the woman's fault. It's not your fault. There are women who right from birth we are born with an abnormal uterus. Yes, congenital uterine anomaly. So it is not their fault. And also, certain structural issues with the uterus, such as polyps, such as fibroid, can also interfere with implantation as well as the development of the embryo. It can also disrupt blood flow to the uterus, thereby resulting in a miscarriage. If you're planning to get pregnant, please ensure you consult your doctor for proper pelvic examination. Number four, infections, yes, such as UTIs, urinary tract infections, and other sexually transmitted infections may also interfere with implantation. So it is important that you get proper treatment for any, yes, if you suspect any case of infection. If you suspect infections, it is important you go to the hospital and get proper treatment. Number five, lifestyle factors. Like I said earlier, smoking, excessive intake of alcohol, and then use of drugs can also interfere with implantation. Yes, it can cause miscarriage. It puts you at high risk of miscarriage. So it is important you live a healthy life, and it is also important to eat healthy food. So having a miscarriage or having series of miscarriages doesn't necessarily mean that future pregnancies will also end in miscarriage. No, that is not the end of the road. I've seen women who have had series of miscarriage, yet they ended up having a healthy and successful pregnancy. So I hope you find this video helpful. Please don't forget to like this video, give it a thumbs up. Don't forget to share this video. If you have any further questions to ask, you can do so by dropping it in the comment section. If you're yet to subscribe, don't forget to do so. Yes, it's simple. You can just tap on the red button which says subscribe. Thank you. As you do that, I'll see you in my next video. Until then,